If you like your health care plan, you'll be able to keep your health care plan, period.
Well, apparently not everyone. This week, shipping giant UPS and the University of Virginia announcing that they are dropping coverage for thousands of workers' spouses, all because of the health care law. And it could get worse. A new survey shows that 40% of companies are planning to change their insurance plans next year because of the new law. So are more Americans going to lose benefits despite what the president said? Hi, everybody. I'm Liz McDonald in for David Asman. So good to be with you this morning. Welcome to Forbes on Fox. Let's go and focus with Steve Forbes, Rick Unger, Rich Carlgard, John Tanmi, Sabrina Schaeffer, and Bill Baldwin. Steve, what do you think?
I think this is just the beginning. Delta Airlines just announced they're going to have to pay $100 million more because of that health care law. Other companies are going to be dropping the spousal offering. You're going to see companies cutting back. And I think secretly, Liz, this is what the president wants. He wants a one-payer system, and the more people you get out of employer-based systems, I think the happier he is, especially when companies can have a $2,000 fine or pay $10,000 or $15,000 per employee. It's going to be a no-brainer, and it's going to be not good for us.
Rick, what do you say?
Well, the only problem with Steve's analysis, it's not dropping anybody out of the employer-based system. Let's be clear on what is happening here. Spouses of employees over at UPS will only not be a part of their health care plan if they have a job at a company that offers them a health care plan. This was written into the law specifically to spread it around. Now, as to
does that make it a good thing then, Rick?
Actually, I think it does. It's going
Why?
because it's going to level it out. I'm not going to be I'm not going to be denied health care if my spouse works at a company that also has it. Not only that, UPS is saying it'll save that employee about $1,300. And let me add one final thing. I am one of those people you just referred to who will be having a new health care plan next year. You know why? I'm going to be getting way more for my money at a fraction of what I'm paying.
Yeah, but costs are going up, Bill Baldwin. And also, with this plan, what's going on with health reform, Bill Baldwin, it's not just dropping spouses. The law says spouses or families. So if you've got a big family and your costs are higher than what the government says, it is true. It's right here.
Not families.
You know what? It's in the law, Rick. Hang on a second, Rick. We'll get back to you in a minute. It's in the law. In the Affordable Care Act, it says spouses or families, if your benefits exceed a certain government-set limit, then that benefit will be taxed, and the company could drop the coverage. What do you think?
I think this has nothing to do with ObamaCare. I think it's only a matter of time before the Republicans start blaming ObamaCare for rising sea levels. This has nothing to do with federal legislation and everything to do with common economic sense. If husband and wife are both working, why should the wife's employer pick up the costs for both of them? Why shouldn't the husband's employer pick up its share of the family's health bills?
Yeah, but
that's
Rich,
fair.
And
by the way, they're not dropping kids. They're just dropping the spouse.
No, wait a minute. You're absolute. Wait a minute. Hang on. Let's go to Rich Carlgard. The law says, Rich Carlgard, spouses or families. In other words, if your benefits are at a certain level, the companies are going to be hit with a tax on that plan, and they could be. I'm talking about the expenses of the plan. They could be hit with the tax, and the companies, in fact, are telling Towers Watson and also telling Kaiser Permanente that the companies are saying they may drop that coverage. Go ahead, Rich Carlgard.
You know, you can't even keep up with the details of this. On a day-by-day basis, there are more complications arise. I would just reduce it to its ultimate simplicity. You know, if this is really such a great plan, why doesn't Obama raise his hand and abide by it himself? Why doesn't Congress, Nancy Pelosi, who said we should need to pass this so we can find out what's in it, why doesn't she volunteer to abide by everything in the plan? The hypocrisy here is just appalling.
Sabrina, all right, so let me just be clear. UPS and the University of Virginia say they're going to keep the family in the plan. What I'm saying is the companies are going to have to pay a higher tax on the plan if the benefits exceed a certain government-set limit. Go ahead, Sabrina.
You're absolutely right. Actually, UPS has determined that their costs are going to go up by 11.25% beginning in 2014. They have to make some changes in order not to have to affect their bottom line. There's so many things written into ObamaCare that are going to cause this increase in costs. Rather, the fact that kids can stay on their parents' plan until they're 26, the fact that we have a minimum essential coverage now, the Cadillac tax, this is a 40% tax, and all sorts of other hidden fees and regulations. So I don't think UPS is any different than Darden restaurants or all sorts of cities around the country country, all of which are going to play a little jigsaw puzzle trying to figure out how not to lay off workers in order to accommodate this new law.
You know, Steve, the president did say, you know, you could keep the plans that you're in, and he also said your costs are not going up. But you know what? Costs are going up about 20% since 2010 for health insurance premiums, Steve.
Yeah, and the only thing the advocates can say is, well, the costs are going up less than it has been in the past, but we've had these periods before when we brought in managed care, for example, when you had a period where they didn't go skyrocketing each year, then the old bad system comes back in and kicks in, and up they go. And the only way you keep costs down with this current system is by denying care, rationing, and that's what we don't want. Why not free enterprise instead of more government domination?
You know, John Tamny, we see increasingly in the Fed Beige Book, which is basically companies reporting back to the different Fed districts, that companies are now saying, you know what? Even the Federal Reserve is saying, hey, companies are telling it that we may have to drop coverage. What do you make of that?
Well, I just think with UPS and UVA, we're seeing a glimpse into the future. Health insurance is a cost. The provisions of Obamacare will make it costlier per employee. And so one logical way to reduce that cost is to force spouses off the program to mitigate the effect of the legislation. And my strong sense is we're going to see more than this. We're going to see a lot of families and wives just voluntarily opt out of the program or health insurance to avoid being a burden on the husband's employment. Obamacare is going to perversely cause more people to be uninsured than was the case before.
Bill, what do you think? Bill Baldwin.
Listen, companies were coming up with schemes to get spouses out 10 years ago, long before Obama came up with his health care plan. They used to give the people bribes. They would say, your spouse is now on the plan. Tell you what, we'll give you $1,000 if you drop the plan and pick up her plan, so then her employer gets stuck with both. Those games are going on for a long time ago. It has nothing to do with this new law.
Sabrina, what do you say? Go ahead.
Yeah, I just think that's off. I mean, look, the main problem with this new law is that individuals are no longer going to be in control of determining what kind of coverage or what kind of risk they want. And so now we have to leave it up to the government to determine. Corporations can't afford that. They can't endure that cost, and individuals are going to suffer. There's going to be a whole lot of sort of unintended consequences. I wouldn't be surprised if we see more women dropping out of the workplace, just as John suggests, to avoid this.
Carl Gar, do you think that could happen, that more women could drop out of the workplace if they don't have coverage?
Yeah, sure. On the margin, why go to work and spend all that money and time, if you're going to have to drop out anyway? Look, what really is disturbing, see this beautiful smartphone cost, $400 or $500. That's got about $10,000 worth of computer power and mid-90s. If it was in the mid-90s, we should have the same revolution in healthcare. I hate this whole discussion in the way that it's, we're in the zero-sum game where we're not involving entrepreneurs who can bring healthcare costs down while delivering higher quality coverage at the same time.
Okay, go ahead, Steve.
And the problem is we're not talking about insurance.
More basic than healthcare is food, and we don't have a government running agriculture, so we have the most productive system in the world, and we have a good safety nets. You can argue about how food stamps are run, but we have a safety net. Why can't we do the same thing in healthcare? Have that productivity, have effective safety nets. Rich and John are absolutely right. Free enterprise is the way to go.
All right, thanks, gang. Up next, college students heading back to school, and more of them are getting student aid as tuition prices keep on soaring. But will that only send tuition even higher? We're going to debate that next. Welcome back. The same week, President Obama hitting college campuses, talking about how to control soaring tuition costs. We're finding out the number of students getting financial aid is also soaring. A new report showing 57% of college kids are getting some type of help from the government, and that's the highest percentage ever. And Sabrina, you say all that aid is the reason why tuition keeps going up. Go ahead.
It absolutely is. Look, as government has expanded their aid programs, demand for colleges, preferably private institutions, has gone up, and colleges in return are increasing their prices. And it's not necessarily equal to the quality of education or skill set that they're leaving students with. So we're seeing since the Clinton administration, the college tuition has increased by $169 billion, and student loan debt is now over $1 trillion, with 70% of students graduating in debt. So this is a terrible situation.
All right, Rick, what do you think?
I think you should be, I know Sabrina feels that way, as many people on the panel do, and if that's the case, you should be thrilled with what the president had to say yesterday. It's going to put controls on exactly the things that are troubling you. It's going to speed people through school so they're paying less money. It's going to create a whole new system of figuring out what schools can deliver the service for less. While keeping education there, you should be absolutely enamored with what the president said.
Steve, with government control, that means, they can, and, by the way, students can't declare bankruptcy. They have no right if they have high tuition costs. With all that government control, does that mean the government can garnish their wages or their tax refund checks if they don't pay their debt?
They won't do it for political reasons, but this is just Obamacare for higher education. I'm out on this one. And in terms of government determining what colleges deliver and what don't, that's just going to become a political football. There's no reason why, Sabrina's absolutely right, there's no reason why college sticker costs should be going up at 4 times the rate of inflation. I think you're going to see a real push for having 3 years instead of 4 years, doing more online, and you're going to see also a push for more schools that teach you a trade that you can actually use right away and get and earn a real degree.
Yeah, or just go to a cheaper community college for the first 2 years and then get the Ivy League banner.
All things the president proposed.
But, I didn't hear that idea. But, Morgan, here's the other thing, too. I mean, when you think about it, we do see California, the two big, Morgan, what do you think of this? 2 of California's biggest public universities in 2011, their tuition costs jumped by, 21%, and they're sitting on $7 billion in endowments combined. What do you make of that?
What I make of that is we have to be very careful with how we break down government aid. On the federal level, we've seen increases for college students, but on the state level, we've actually seen those numbers scale back a little bit. I think it's also important to not make this, college aid is the, college tuition rising is because of government aid. I don't think it's a direct correlation there, and part of the reason is because we've seen states cutting back their funding to colleges as well. That's part of the reason we've seen tuition go up. We've seen it go up from 2007 to 2012. We saw those cuts on the state level.
But you think it partly exacerbates it. What do you think, Mike Ozanian?
I think it's basic supply and demand, EMAC. Look, when the Federal Reserve floods the economy with cheap dollars, stock prices go up. When it floods the college education market with cheap money, the cost of tuition go up. It's no different.
John Tenney, what do you think?
Well, just the latest evidence that when compassion drives public policy, the result is ultimately cruel. You have the federal government saying that, hey, let's make it sure that everyone can go to college, so let's make it affordable, and the end result is that it's unaffordable, and we know why. Right. When you know that someone's spending the money of others is going to back up loans for tuition, it's only logical that that tuition is going to rise. Now, this isn't the sole driver of it, but it's a big factor.
Rick Unger, I mean, yeah, it's a factor, but also what's going on with colleges and their staffing and how colleges are, fat cat academics think they're running hotel empires. We've talked about that. That's partly driving it, too. What do you think?
Actually, I agree with that. There is an element of that of tenured professors. I see way too much building going on, spending a lot of money at some of these campuses. But let's keep this in mind. Steve identified some important points.
That's privately funded.
The president actually spoke to that. He did talk about creating a situation where kids will get to school quicker using the internet, using accredited courses for college while you're still in high school, using 2-year universities. He talked about all of that as a way of bringing costs down, not to mention also monitoring if kids are finishing classes and getting credit if they want to keep getting money.
Sabrina, jump in. Go ahead.
Yeah. You know what I didn't hear the president talk about, which is what students should be thinking about, are the decisions that they make. Do they really need to go to the private institution, or could they go to the public one? Do they want a degree in anthropology, or is one in computer science maybe more practical for the kind of career that they're going into? And I I that's something.
I think Morgan's got something to say about that.
Talk about individual choice, right? Sorry, Morgan, go ahead.
No, I'm an anthropology major. That's why I say that. But there's another factor.
That's why you're like digging around.
There's another factor at play here, and that's the fact that we've seen the number of college students increase because of the poor economy. People can't find jobs. They go back to school. We've seen those numbers increase by, I think, about 12% in the last couple of years. It's another reason why.
Well, wait a minute. Is that why? But that's not why tuition costs are going up.
But that's one of the key factors as well, and this is something that needs to be looked at. And that's schools get their federal money based on how many people are enrolled in school.
Okay, hang on.
That does need to change.
I hear what you're saying about that. John Tanney, go ahead.
Well, look, there's no difference between private and public schools. Someone's paying for it either way, and if you want to bring the cost down, just like with any other good that's desirable, is get the government out of it. When the government involves itself in housing and health care and education, costs go up because they know that someone else is paying for it. When the government's out of the way and private markets are at work, people have to compete for your dollar, and they usually lower the price. This is really simple. Basic economics.
All right, we got to leave it there. Thanks, gang. Just when you think it cannot get worse, a new report